Hi, my name is Dr. Lexie Wang. I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Before we go into our big nose series, I want to start out with simple definitions so that way we're all on the same page and no one's confused when I start saying certain words. So we'll start with the external and what you see on your nose, okay? Obviously, this is the nose. Up here, we call this the nasal starting point. It's also called the radix, the nasion, all these other things. You don't need to know that much about that because probably you're never going to communicate it that way to us, but this is the nasal starting point. When you're looking on front on, the nose is divided into thirds, okay? So you've got your upper 1/3, which is composed of the nasal bones. You have your middle 1/3, which is composed of cartilage. And then you have your lower 1/3, which is composed of cartilage. The bones are only involved in the upper 1/3. In this middle part, we'll talk about the interactions in terms of the several pieces of cartilage there that play a key role in the width of the nose as well as your breathing function. And then the tip area, this lower part of the nose, this is the part where all the excitement happens. We've got the tip itself, we've got the nostrils or the ala. This area from here to here is called the nasal base. So how the nose sits on the face is called the nasal base. And then this middle area is called the columella. We've got the dorsum, also known as the bridge. So the dorsum is from here down. Then still we've got our tip. This is the part we start to break things up, okay? The thing that a lot of patients come to me for is they want a really good supra tip break. So if you can imagine this point right here is the tip. The supra tip is right here, supra meaning just above the tip. I don't think I have the best supra tip break, but it should be right here. And then you have your tip, and then you also have what's called the infratip area. The infratip area is below your tip, but before we turn into the columella. So this little kind of bulb right here, and that's another area that usually people are trying to address when they come to me. So now that you know what those things are, whenever you go to a rhinoplasty consult, you can talk a little bit more educatedly and make sure that your surgeon actually understands what you're trying to say. If you just say things like, I don't like the dorsum of my nose, we can only guess what that means. But if you say, well, I mostly like the dorsum, but I really want a stronger super tip break, then I know exactly what you mean. So hopefully that was helpful. Some basic terms in nose anatomy, and I will see you guys next time on Face the Facts. My name is Dr. Lexie Wang at West End Plastic Surgery.